everyone, welcome to my channel. In this video I'm going to talk about bronchitis. What is bronchitis and how it affects our day-to-day life, and who are the persons who are really suffering with bronchitis. Bronchitis can be treated with homeopathy, because most of the people who has this kind of bronchitis hear that from an allopathic doctor that it cannot be cured. It's going to be repeat again and again, so you should be careful like this, like that, and everything. If that is your question, then this video is for you. Of course, bronchitis can be treated with the help of homeopathy. Of course, it can be treated completely for your lifetime. That is 100% guarantee from every homeopath. Okay, but you should give an proper case, and you should have some patience, and you should also follow what the homeopathic doctor has been saying from an start. Of course, it takes some time to get it cured completely, because removing the root cause from your body is difficult, because you can just cut the branches of the tree within 2 to 3 hours, but you cannot cut the stem. It takes at least 1 day or 2 days, or if old tree it is, and 3 to 4 days, right, like that. You should also consider that time factor, and you should also kind of give that kind of time for the doctor, and also follow the instruction. Myself, Dr. Mega from Homeopathic Clinic. I am a practitioner of homeopathy from 5 years. Okay, without any delay, let's move on to today's topic, that is bronchitis. Bronchitis is of two types. One is acute bronchitis, another one is chronic bronchitis. So, in this video, I'll be saying you the treatment for the chronic bronchitis, because acute bronchitis can be treated with any kind of medicines. But chronic bronchitis is not like that, because there is an inflammation of the bronchi, and it has already deep seated, and it should be given a complete and a very long treatment for the repair of the bronchitis. Okay, what is bronchitis? Is infection or the inflammation of the bronchitis. Okay, now we will be talking about few homeopathic remedies which are really helpful in the treatment of bronchitis. My first consideration for the bronchitis is that kali kab. Why, doctor? Why you are giving the kali kab? Why other remedies are not going to work? Or what? If you ask, of course other remedies are going to work, but for me, for the bronchitis, the kali carb has given so much of results which I cannot even imagine. Because previously I was also not into that kind of kali carb kind of thing, but after I treated one of the long standing bronchitis with kali carb, only kali carb, that too with only lower dose, that too 30, I was really kind of left like what it has been happen. Okay, like that. So for me, kali carb is the first choice in the bronchitis. It may be acute bronchitis or chronic bronchitis. You can give the kali carb, where the mucus is very kind of tough and stingy, and it's always difficult to put it outside. And also the patient says that they have this wheezing kind of thing whenever they are breathing, and the patient will be so much restless. How to identify kali carb patient? One thing you should know is what is kalis. Kalis are very strict. Okay, the patient will be like, doctor, I had went to this, that, and everything, but no one cured me. I does not know what to do, like this and everything. When you see someone who is with them, you can see that they are strict to them. Okay, so that kind of thing. And also you can also see that they are also trying to say what has happened to them, because no other patient says what has happened to them, but they say even the lightest and the simplest thing for you guys. So that is one, and they will be very kind of healthy. It's not like they are not healthy. They eat everything they get. They are not choosy. They are not I'm not eating this, I'm not eating that. No, not like that. Even the things which are allergic for them, they also tend to eat. And another one thing you should also, when you're giving the kalikab, it's an bonus. Like, respiratory symptoms are associated with the skin symptoms. We should also look into that. If that kind of case you had got, and you had got all kind of kalikab symptoms, then fix that case that I'm going to cure you 101%. There's no doubt about it. Just take the treatment like that. You can close your eyes and you can give the medicines. The skin symptoms and the respiratory symptoms both will be gone, because the suppression of emotion has caused the skin symptoms. The suppression of skin symptoms has caused the respiratory symptoms. So first what it will be treated is the mind symptom. What has happened, what kind of tragedy has happened in their family, because kalikab is that kind of patient who is always worried about their family, about their health, and about their family health. One thing will be that if they had lost their family member, or something has happened to their children or husband or whatever may be there, some kind of very tragic thing has been happened. So try to rule out that kind of thing. After that you can also go with symptom thing, and after taking the symptoms, after taking the time modality, that is during the night time or when they are sleeping, or during the midnight time, the wheezing is more, and during the rainy season or during the winter season the symptoms are more. And it does not come every year, it comes 2 year 3 year once, like that. And this kind of thing will be there. And also try to talk with that patient and with other member of the patient also, because if they are hiding something like that, after that you will be able to rule out that okay, this is the cause. And the mind symptom, when you try to change it, means they should accept the reality that this things happens for everyone. One or the other day, of course, this kind of thing happens for everyone. So there is nothing to be taken into their mind. Okay, just give them 5 to 10 minutes of counseling. After that, give them the treatment. Don't expect that skin symptoms and the cough symptom to go completely. No, it will be gone. At least the acute management will be done with the kalikab, but the kalikab will be working on the mind. So give it some time. When the patient feels little bit restless, free and anxiety free, everything fear free, because they will be having so much of fear of thief, because the family is not as before, like that and everything. So give them some kind of safety, some kind of uh, thing which they can really feel like okay. That kind of mental stability will be given first with the help of kalikab. Then you can see the some changes in the skin and the respiratory. Don't get or don't change or don't do anything if the symptoms have been aggravating. Of course, little bit it aggravates sometimes, but don't give it any kind of other remedies, or don't change the potency, or don't stop the medicines. Okay, from my advice, always if you're treating a chronic patient, go with the lower potency. 30 ch is also okay, but start with 30 and be with 30 till the patient goes till 98%. After that only you can give 200. After that, go for next last thing, closure you will be giving in 1 m potency, like that. Because chronic should be treated daily dose, and the daily dose can be given when you are giving it in the 30th potency. I think this video was helpful. Of course, I had talked bronchitis, chronic bronchitis, and one of the major homeopathic remedy, that is the kalika, which is really helpful in the treatment of bronchitis. Thank you so much. Please to like and subscribe, and don't forget to press on the bell icon so that whenever I put a new video you will be notified. Myself Dr. Megha from Homeopathic Clinic. I am a practitioner of homeopathy from 5 years. I deal with all kinds of complaints in the day-to-day practice, but if you want to know any kind of treatment in the homeopathic aspect which you are having doubt, or if you are willing to take the treatment, just comment on the comment section. Thank you. Bye bye. Have a nice day.